Hello, and welcome to Safer Sex 101. Here in the Office of Health Promotion, we believe students need to be well in order to do well during their time at SHSU. This means taking care of one's health so academic success can remain a top priority. Although it may be an uncomfortable topic for some, today we plan on addressing the importance of sexual health. According to the World Health Organization, sexual health is a state of physical and mental and social well-being in relation to sexuality. It requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having a pleasurable and safe sexual experience, free of coercion, discrimination, and violence. As we break down how and why to remain sexually healthy, we will talk about what sex is, quickly review the sexual anatomy, debunk some popular sex myths, and discuss safety and prevention. Remember, we are not here to pass judgment or dictate anyone's sexuality. Our only goal is to provide accurate information to help you make healthy decisions that are right for you. So with that being said, let's talk about sex. Many people have different definitions for what sex is. Throughout this video, we will define sex as the stimulation of sex organs between consensual partners with the goal of reaching orgasm or to reproduce. There are three types of sex that we will discuss today: vaginal sex, which is inserting the penis into the vagina; anal sex, which is inserting the penis into the anus; and oral sex, which is the stimulation of the genitals with the mouth, lips, or tongue. Oral sex performed on female sex organs is called cunnilingus. Oral sex performed on the male sex organ is called fellatio. Oral sex performed on the anus is called analingus. There are a lot of reasons why people have sex. Some reasons include, but are not limited to, having children, for pleasure, to connect emotionally with the partner, to relieve stress, or as a sign of love. Unfortunately, some people have sex for negative reasons as well. Examples of these may include having sex for validation, to get ahead in a competition or for status, to avoid emotional intimacy because of sad or lonely feelings, to get someone to like them, or because they were forced. If these apply to you or someone you know, we encourage you to get in touch with one of our counselors at the SHSU Counseling Center. They can be reached at 936-294-1720, or by stopping by the second floor of the Student Health and Counseling Center. Something many college students wonder in regards to sexual health is, what is normal? Well, what one person considers normal might be completely different from what another person considers normal. It's important to understand that sexual preference varies greatly among individuals and can change throughout a person's life. However, there are three key things that should be standard in anyone's sex life. Number one, sex should always be consensual between partners. Sex without expressed consent is rape. Number two, sex should be safe. There should be no risk for disease transmission, unplanned or unwanted pregnancy. Number three, sex should be healthy. A certain level of trust and understanding should exist among sexual partners. Each person should be on board with all sexual activities. If you feel your sexual activity does not include these three key standards, you may need to have an honest conversation with your partner about your wants and needs so you are both on the same page.
To understand how birth control methods work and how STIs affect the body, you'll need a general understanding of the reproductive anatomy. We understand that gender and gender identity are fluid and the terms male and female may not accurately represent everyone viewing this video. However, for the sake of educational illustration, we use these terms to describe the feature in the reproductive system. The outer male reproductive anatomy consists of the penis and the scrotum. The penis in this diagram is considered uncircumcised because it has the sheath of skin covering the head of the penis. A circumcised penis would be missing this extra skin. Behind the penis is the scrotum, also known as the sac. The scrotum is a pouch made up of skin and smooth muscle that holds the testicles. The inner male reproductive anatomy includes the urethra, testicles, vas deferens, and anus. The urethra is a narrow tube that carries urine and semen out of the body. The testicles, which are located in the scrotum, are responsible for making and storing sperm. The vas deferens carry semen from the testicles to be ejaculated when the male chooses to have permanent surgical form of birth control called a vasectomy, it is the vas deferens that is cut, tied, or blocked so that the sperm cannot release. The outside of the female reproductive anatomy is collectively called the vulva. This consists of the clitoris, urethral opening, labia majora and minora, and the vaginal opening. The clitoris is also known as the clit, is located at the top of the vulva and only has one function, pleasure. The urethral opening, located below the clitoris, allows urine to leave the body. The labia majora and minora, also known as the outer and inner lips of the vulva, protect the delicate inner features of the vulva. The vaginal opening allows menstrual fluid to leave the body during menstruation. An inside look of the female reproductive anatomy reveals the ovaries, fallopian tube, uterus, cervix, and vaginal canal. The ovaries produce, store, and release mature eggs into the fallopian tubes where they pass into the uterus. The uterus, also known as the womb, will house an egg released by the ovaries until it is expelled during menstruation or fertilized with sperm. The uterus contains some of the strongest muscles in the female body which allow it to expand and contract, accommodate a growing fetus, and then help push the baby out during labor. The cervix connects the uterus to the vaginal canal. It is a very small opening that can expand up to 10 centimeters during childbirth. The vaginal canal, also known as the vagina, is the path baby will take to exit the body during birth. It is also utilized during vaginal sex. Though the reproductive system has natural features that offer protection to its sensitive structures, such as the scrotal or the labia, it is still vulnerable to sexually transmitted diseases and infections. Sexually transmitted infections, or STIs, are infections that are contracted through sexual contact with an infected person. STIs pass from one person to another through skin-to-skin contact, blood, semen, vaginal, or other bodily fluids. A common question we are asked is, what's the difference between sexually transmitted infection and sexually transmitted disease? These terms are often used interchangeably, but they technically have different meanings. Having an STI means that an individual has an infection that has not yet presented any noticeable symptoms, whereas signs and symptoms are present with an STD, such as fever or rash. It is important to understand that people can have an STI and be asymptomatic or not show any symptoms of their infection. Remember, you can't tell if a person has an STI just by looking at them. There are a lot of myths and misinformation surrounding sex and STIs. Let's see if you can tell what's true and what's false. 25 to 44-year-olds account for 50% of all sexually transmitted infections each year. False. 15 to 24-year-olds account for 50% of all new sexually transmitted infections each year, even though this age group only makes up 25% of the entire sexually active population in the U.S. STIs can develop in and around the mouth or throat from oral sex. True. STIs can also develop in or around the anus from anal sex. STIs result in about $16 million in healthcare costs each year. False. STIs result in about $16 billion in healthcare costs each year. Birth control methods such as the pill, Depo-Provera, or pulling out do not provide protection against STIs. True, the only birth control method designed to provide protection against STIs are using condoms or simply not having sex. Women can get yeast or other bacterial infections from oral or manual sex or unclean sex toys. True, yeast and bacteria thrive in dark, moist environments. A person who has an STI but does not show symptoms can't infect others. False. Regardless if symptoms are present, an infected person can spread their STI to others during sex. Hopefully you got most of these right. There are some myths we didn't quiz you on, but we think it's important to talk about them anyway. A person cannot get an STI from a toilet seat. A person can get an STI the first time they have sex. A person can get the same STI multiple times after they've been treated for it.
According to the World Health Organization, there are over 30 different STIs in existence. Let's briefly talk about some of the most common bacterial and viral STIs in the U.S. Just as a warning, graphic pictures will be shown in this section. Bacterial STIs are infections caused by bacteria that can typically be cured with an antibiotic. It is very common for those with a bacterial STI to be asymptomatic or show no symptoms. 3 common STIs are chlamydia, gonorrhea, and syphilis. Although chlamydia is the most commonly reported STI, we often discuss chlamydia and gonorrhea together because they share many of the same characteristics. Both typically display no symptoms. If symptoms are present, they generally include genital discharge and painful urination. If left untreated, chlamydia and gonorrhea can spread to other parts of the body, causing further complications, increase the risk for pelvic inflammatory disease in women, a very painful condition with severe health consequences, cause an ectopic pregnancy, which is a pregnancy that has taken place outside of the uterus. Ectopic pregnancies are dangerous for the mother and almost always fatal for the child. Syphilis is also a bacterial STI that can be treated with antibiotics. A syphilis infection has 3 distinct stages. The primary stage is characterized by a painless sore called a chancre that appears at the infection site, typically in the mouth or on the genitals. Although these sores look painful, they do not hurt. This could cause a person to either not notice the chancre or not seek medical attention. Chancres will heal on their own after a few weeks, but a person can still spread syphilis during the healing process. The secondary stage of syphilis is an irritating and sometimes painful skin rash that can develop over large areas of the body. The rash will go away even with no treatment, but if the syphilis is not treated with an antibiotic, the infection can reach its 3rd stage. If a person reaches the 3rd or tertiary stage of a syphilis infection, they will experience vision problems and severe central nervous system complications, such as numbness and problems controlling muscle movements, even death. Viral STIs have very different characteristics from bacterial STIs. Viral STIs are caused by viruses and are incurable but manageable through the use of expensive drugs and treatments. Similar to bacterial STIs, a viral STI infection can be asymptomatic. Herpes is a viral STI that is very contagious and remains with the infected individual for life. There are 2 types of herpes, simplex virus 1 and simplex virus 2. Herpes simplex virus 1, or HSV1, is the oral form of herpes that is transmitted by oral to oral or oral to genital contact. In symptomatic cases, HSV1 results in cold sores on or around the mouth. Herpes simplex virus 2, or HSV2, is sexually transmitted and causes sores on or around the genitals. It's important to know that both oral and genital herpes are very common in the U.S. However, many people don't know they are infected because they are asymptomatic. Their symptoms are too mild to notice, or they've mistaken their symptoms for something else. While herpes is not curable, there are treatments available that can help shorten the length of an outbreak. For healthy adults, excessive health problems from herpes is rare. However, herpes can be spread to an infant during birth or through oral contact, like a kiss, causing neonatal herpes. This is a serious and sometimes fatal condition for infants. The human papillomavirus, also known as HPV, is another viral infection that is very common. In fact, more than half of all sexually active people worldwide are infected with the HPV, making it the most common STI. There are over 100 different strains of HPV. However, some strains have more serious health consequences than others. For example, certain HPV strains can cause genital warts in males and females, cervical cancer in females, and urethral cancer in males. Although HPV is incurable, people can reduce the risk of contracting the more high-risk types by getting the HPV vaccines between the ages of 9 and 26 years of age. The human immunodeficiency virus, or HIV, is the viral STI that we hear mentioned most often. HIV is transmitted by contact with infected blood, semen, vaginal fluid, or breast milk. The HIV virus attacks the immune system, which makes it difficult for the body to fight off other infections. individuals infected with HIV are more vulnerable to even the mildest illnesses and take longer to recover from them. When the number of infection-fighting cells a person has drops below a certain threshold, the HIV virus will reach its most advanced stage, acquired immunodeficiency syndrome, or AIDS. The progression of HIV to AIDS can take many years, which is one reason an infected person can continue to spread it to others unknowingly. Symptoms of HIV and AIDS include fever, chills, rash, muscle soreness, tiredness, and recurring infections. Remember, many STIs, including HIV and AIDS, can show no symptoms, so it is important to get tested and know your status. There is no cure for HIV or AIDS, but those who are at risk for contracting the virus should speak to their doctors about taking a pre-exposure prophylaxis, or PrEP, in addition to practicing safe sex. Unprotected vaginal sex can not only lead to STI transmission, it can also lead to pregnancy. Pregnancy is possible anytime vaginal sex occurs without the use of contraception, especially when a woman is ovulating. There are many myths regarding sex and pregnancy, and we'd like to clear things up on just a few of them. Myth number 1, condoms provide 100% effective protection from pregnancy. This is false. External condoms, or condoms which cover the penis, are 88% effective, and internal condoms, which are inserted into the vagina, are 82% effective, both when used perfectly. Myth number 2, you can't get pregnant the first time you have sex. This is also false. Having sex for the first time is typically no different from any other time. Therefore, it is important to use contraception at all times if pregnancy isn't in your plans. Myth number 3, you can't get pregnant if you have sex in a pool, shower, or hot tub. It doesn't matter how much water is present, pregnancy can occur if contraception is not being used. False. Myth number 4, preventing pregnancy is the woman's responsibility. False. If both partners agree that pregnancy is not in the plans, both partners are responsible for making sure contraception is used.
The decision to engage in sex is very personal. You should only have sex that is consensual, meaning that all partners give permission, healthy, meaning that trust and understanding exists between all partners, and safe, meaning that there is no risk for STI transmission or an unplanned or unwanted pregnancy. The only sex that is 100% safe is no sex or practicing abstinence. If you choose not to be abstinent, we encourage you to practice safer sex by doing things like using contraception, engaging in long-term mutual monogamous relationships with an uninfected partner, and limiting your number of sexual partners. You can reduce the likelihood of an unplanned pregnancy or contracting an STI. Practicing safer sex doesn't have to be difficult or expensive. For example, one way to have safer sex is to use condoms. Condoms are about 85% effective in preventing pregnancy when used consistently and correctly. To increase the effectiveness of condoms, they should be stored in room temperature, kept away from sharp objects that could puncture or tear the condom, and used with personal lubricants like KY jelly or Aquaglide. Avoid using products like body lotions, oils, or Vaseline, as this could compromise the condom and cause it to tear. Condoms are inexpensive and come in a variety of colors, sizes, textures, and flavors. There are 2 types of condoms that are widely available: external and internal. External condoms are placed over an erect penis just before intercourse. Internal condoms are placed inside the vaginal canal, either just before intercourse or up to 8 hours before. It is important to use a new condom every single time you have sex, and use only one condom at a time. Some may think that using more than one condom offers additional protection, but it can actually cause the condom to tear and become ineffective. Condoms are also ineffective if you use an external and internal condom at the same time. Again, only one condom at a time is necessary. Both external and internal condoms have advantages, so be sure to do your research to find out which is right for you and your partner. We'll show you 2 short demonstrations on how to properly use external and internal condoms. It may take some practice to get right, but when used consistently and correctly, condoms are effective in preventing pregnancy and the transmission of STIs. Communicate with your partner to get consent and discuss STIs and birth control methods. Check the expiration date on the condom wrapper and look for any punctures. Open the wrapper without tearing the condom. Hold the condom by the last ½ inch at the tip to squeeze out any air. Put the condom on the tip of the penis while the penis is hard and before the penis touches a partner's genitalia, mouth, or anus. Pinch the tip of the condom and unroll the condom down the shaft to the base of the penis. During intercourse, check the condom to ensure it hasn't slipped off or broken. If it has, start over with the new condom. Dispose of the condom by tying the end in a knot and throwing it in the garbage. Communicate with your partner to get consent and discuss STIs and birth control methods. Check the expiration date on the condom wrapper and look for any punctures. Massage the package to distribute lubricant and open the wrapper without tearing the condom. Hold the condom at the closed end, open end hanging down. Grasp the flexible inner ring and squeeze with the thumb and middle finger so it becomes long and narrow. Squat, raise one leg, sit or lie down. Gently insert the inner ring into the vagina. Push the inner ring up and back into the vaginal canal, moving it into place. Push the condom as far as it will go near the pubic bone. Make sure it is not twisted. The outer ring remains outside the vagina. Gently guide your partner's penis into the vagina. If there is discomfort, withdraw the penis and reposition the inner ring. After ejaculation, remove the condom by twisting the outer ring and gently pulling the condom out. Wrap the condom in the package or tissue and throw it into the garbage. An internal condom can be inserted hours before intercourse. You can find condoms in just about any drugstore, grocery store, or gas station. SHSU students can also purchase condoms from the vending machines in certain residence halls on campus or grab some for free at the Student Health Center. There are also Trojan Magnums and other birth control methods available for purchase. Just see any Student Health Center staff for more details.
It is important to communicate effectively with any potential sexual partners. Always be upfront about your expectations and don't be afraid to ask about their STI status. Anyone who has previously been or currently is sexually active should be tested for STIs. If you have had sex without a condom, if your partner has had symptoms of an STI, or if your partner tells you they are getting tested or treated for an STI, you should get tested for an STI. If you've ever been raped or sexually abused, please seek medical attention as soon as possible and ask to be tested for STIs. Getting tested for an STI can be stressful, but being aware of your status and taking control of your health is one of the best things you can do for yourself. And it doesn't have to be difficult or expensive. The Office of Health Promotion offers free STI testing during the Get Yourself Tested event, or GYT event. Testing is quick, confidential, and convenient. You can get tested by making an appointment with the Student Health Center, visiting Huntsville Memorial Hospital Medical Clinic, the Pregnancy Care Center in Huntsville, or by seeing your primary care provider. If you do receive positive test results, follow the advice and instructions of the testing agency and make an appointment to be retested if necessary. Avoid having sex until you've received treatment and ask your provider about ways to have safer sex. Inform your current sexual partners that you have been tested and tested positive for an STI and encourage them to be tested as well. Begin the treatment recommended by your provider as soon as possible and confide in your support system if you need help processing what has occurred. Receiving a positive test result may be difficult to deal with, so it is essential to talk to someone you know and trust about what you're going through. Testing positive for an STI is a serious wake-up call for anyone. Remember, practicing safer sexual habits will help you to ensure your time at SHSU is enjoyable and successful. After all, Bearcats need to be well in order to do well. We hope this information about sexual health and how to have safer sex has been helpful. We encourage you to enjoy your time here at SAM by having fun, making healthy decisions in regard to your sexual choices, and succeeding in all of your academic endeavors. If you have any questions, please contact our office by emailing us at healthpromotion@shsu.edu, or you can follow us on Instagram and Twitter at @SHSU_OHP, or like us on Facebook at SHSU Health Promotion.